I think the research in JAK inhibitors, particularly in the use in systemic lupus erythematosus, is exciting. We have had very few drugs approved for lupus. We have had one approved in the last few years, but there is a dearth of drugs that we have approved for lupus. And the FDA has just recently fast-tracked one JAK inhibitor in the study of lupus, and there are other JAK inhibitors that are being looked at in lupus. You know, treating, utilizing medications that work intracellularly to stop the production of the cytokines, I think is where a lot of the research is going. Does dosing make a difference? Do the varying JAK combinations, how is that going to affect various disease states? I think that's been very exciting. You know, patients always ask me, how did I get this? And, you know, and we always say, well, there's probably a genetic susceptibility and then some type of a trigger. I think one of the most exciting things that's coming out, and not just in autoimmune disease, but is the entire field of epigenetics. And epigenetics can, these are the genes that can turn off and on the genes that code for the various cytokines. And those can be changed by environment. You know, it's been shown that everything from sunlight to infections to even stress can affect your epigenes. So I think in terms of autoimmune disease, when we know sunlight can change the epigenes and turn them off and on and trigger DNA methylation that affects T cells, I think that's probably one of that's going to be on the foreground of research in genetics and epigenetics. You know, everyone talks about personalized medicine, and whether it's in oncology with immunotherapy, and I think in rheumatology, we're looking at, we would like a biomarker to tell us what's the perfect drug to use in this patient. And I think we're sort of getting, you know, some headway in that question. There are studies out there trying to decide, would this patient, based on biomarkers, respond to a TNF inhibitor or not? Or would it be better to use another medication? Can we have a biomarker that will give us an idea of the course? Is this going to be a rapidly progressive rheumatoid patient? You know, we have some things already that tell us if you have a high rheumatoid factor, if you have other, you know, non-articular manifestations, perhaps there might be a stronger course. But I think everyone's looking for that one test that will tell us what's going to happen with this patient and what's the best drug to use. And I think that's in our future. We'll be able to do that one day.